All right, welcome everyone. So we are going to start our educational movement with the endocrine system. So let's get a brief overview of the biggest things I think you need to know for nursing school. And this will also tell you the topics that we'll be covering here. And remember that my PowerPoints are really broken down and they really oversimplify the topic because I'm trying to literally get you to understand the pathophysiology, put things together, and honestly know the most important things, because reading through your textbook can often be very confusing. So let's talk about what we'll be running through in this series of the endocrine system, and then you understand what to expect in future videos. So here's an endocrine system overview. Now, the endocrine system works in conjunction with the nervous system to help maintain homeostasis in the body. And this ensures that the body functions as smoothly as possible. Big thing for you to remember is that the endocrine system is made up of a group of glands and organs that produce and release hormones. And this will be important for you to know because you will be talking about these glands and hormones as we move forward. So what are these hormones, right? The hormones include the adrenal corticotropic hormone, which you see as ACTH, follicle stimulating hormone FSH, growth hormone GH, luteinizing hormone LH, prolactin, and thyroid stimulating hormone. Now these hormones, they usually are released and they will travel through the bloodstream and carry messages that regulate different body functions like growth, metabolism, reproduction, and the body's response to stress. Now, as far as glands go, we have the pituitary gland that is in the brain, and it's usually controlled by the hypothalamus, that part of the brain. And the pituitary gland is divided into the anterior pituitary gland and the posterior pituitary gland. Now, the thyroid gland is in the neck, and it focuses on metabolism. That's why when you see patients having thyroid surgery, it's usually in the neck that surgery is done. The parathyroid gland is a small gland on the thyroid, and that one regulates calcium levels. So that's why anytime you see in your textbook the mention of parathyroid, you always see calcium very close to it. The adrenal gland is located on the top of the kidneys, and this one manages stress response and blood pressure. Now, the pancreas is also categorized under our endocrine system, and it's involved in digestion and production of insulin and glucagon, which help us regulate our blood sugar. Now, key focus points for you to remember. For review purposes, we're going to cover the following conditions. Under the anterior pituitary gland, we're going to talk about disorders such as acromegaly, gigantism, and dwarfism. Under the posterior pituitary gland, we're going to talk about disorders such as diabetes insipidus, syndrome of inappropriate secretion of antidiuretic hormone, SIADH. Now, key things to remember: the adrenal gland disorders include Addison's disease, Cushing's disease, and pheochromocytoma. Now, thyroid gland disorders include hypo and hyperthyroid. Parathyroid gland disorders include hypo and hyperparathyroid. Pancreas-related disorders include type 1 and type 2 diabetes, and then metabolic syndrome, diabetic ketoacidosis, also known as DKA, and hypoglycemic hyperosmolar state, which is HHS. So this is all that you should be expecting from this page as we talk about the endocrine system. So if you have questions about any of them, I need you to leave me a comment and let me know if you're excited to actually go through this journey, as I will be posting about every single disorder and breaking it down so that you can use this in addition to studying in class, to your teacher's PowerPoint, to your textbook, and any other resources that you find out there that you will be using. Okay guys, I hope that you stick with me, and don't forget to subscribe to this page so that you can always be able to come back and look at these disorders, and also turn on your notifications so that you're alerted whenever I post a new video on a different disorder. Okay, till the next video, have a wonderful day. Bye-bye.